right now, I'd like to welcome back, because he's been on before, Dr. Sandeep Thakkar. And you are a neurologist and movement disorder specialist. And what you focus on is Parkinson's, and this is with the Pickup Family Neurosciences Parkinson's and Movement Disorders program. Welcome back, sir.
Thank you for
having me. Nice to have you back on again. Let's kind of, before we get into some of the treatment and things, let's kind of go back to maybe what are the first signs of somebody who has Parkinson's versus someone who may just have tremors. They might move their arm in a certain way and they shake a little bit, but it's not necessarily Parkinson's. When does an individual or maybe their family member kind of notice that maybe it's something more?
That's a great question, because most people think of Parkinson's as purely a tremor disease state.
Right.
And 30% of patients actually don't have any form of Parkinson's, any form of tremor that's typical of Parkinson's.
Okay.
It kind of may progress in the disease state, but again, 30% of patients may not even present throughout the course with the tremor. The tremor typically is actually a rest tremor, where they're maybe sitting and completely at rest and they start shaking. The old terminology used to be a pill rolling tremor. And so the degree of tremors actually have changed. We're evolving in understanding what Parkinson's is, and it's just not just a tremor disorder. It is a slowness disorder. It is a walking imbalance disorder.
Okay.
And so we kind of now have realized that maybe a family member kind of picks up a tremor and may just say, oh, what's going on? And usually a patient may say they feel nervous, but we're trying to make sure and distinguish what that tremor is, and if it's, make sure it's not just a medicine-induced tremor as well.
Okay, so there are sometimes people can have tremors or something that have nothing to do with Parkinson's.
Correct.
Okay. Now, once you kind of figure out what this person has, and another part of this that I want to ask is it helpful to determine it early? Is it curable? Is it just managed? How do you go about this with the different treatment programs and getting the opinions from specialists and all?
Yeah, unfortunately, at this moment in time, Parkinson's as one of the neurodegenerative disease states is not a curable disease, but we can manage it so well in the degree, just like how diabetes used to be a uncurable or unmanageable disease state and people would get gangrene and have complications. Parkinson's is now that stage where it's not meant to be a life-threatening disorder. We can manage it with great medications. We're having such fantastic surgical options as well, and newer pharmaceutical and device companies are in the manifestation of helping us as physicians promote and educate patients about what's best for them and which tool we need to incorporate for health.
When it comes to Parkinson's versus other movement disorders, where does it manifest from? Is it from the nerves themselves that are degenerating? Is it something that's going on in the brain? Is it a little bit of both?
It's always been a neurological nerve-related disease, and
Okay.
in the deep structures of the brainstem. So our brain sits on a brainstem, and then that connects then to the spinal cord, and then the nerves come out to the muscles. And there's certain chemicals that we call neurotransmitters that are reduced, and the specific one is dopamine.
Okay.
And we now know that other neurotransmitters are also involved, but actually the uniqueness of the disease state and what we're understanding of pathology is that it may actually even be starting in the stomach and the gut, and then the GI system's involved. And whatever our exposure to toxins, foods, dietary type of factors may then spread to the nerves and then get into the nervous system.
Okay.
And what's so unique and fascinating about the disease state, if we can maybe block these abnormal growths of proteins that are coming from our GI system, we may have a way of curing or modifying the disease altogether.
Yeah, it's interesting that you bring that up, because seems to be sort of the same sort of line of studies in that effect with Alzheimer's, with lupus, with things like that, where they're kind of looking at, is this coming from toxins, is this coming from this, is it whatever it might be, but they're beginning to look in those areas where to try and pinpoint. You mentioned, the dopamine and things like that. What are some of the therapies and the latest treatment options?
Well, we always suggest that regardless of just medicine, it's all about diet and exercise, getting good sleep habits, and making sure that the whole person as a whole in general is taken care of, and any comorbidities, hypertension, diabetes, cholesterol is managed as best as possible. And then when we do actually get to the Parkinson's component is, yeah, we have oral medications that are very useful. We have different patches. Our mainstay is to keep dopamine levels stable. Now, we don't have a blood test for dopamine, but we know clinically how a patient's absorbing the medicines and how it's kicking in and working. That's why it's so important as a specialist to monitor patients over time. And if the medications are not working as well, we have two surgical options, which is deep brain stimulation or a new type of therapy, which is called duopa, and it's a pump that delivers dopamine in a continuous fashion.
So that would be the same way as a diabetic has a little pump on the side?
Exactly. Yeah. We always say that neurology is sometimes 20 years behind cardiology and now maybe 10 years behind endocrinology, but we actually do have a pump that maintains that therapy.
Ah, interesting. So someone who might be living with Parkinson's, again, it's totally different from different people. I mean, there are people who maybe have it very early in life, later on, may progress very slowly to the point where even when they get to be in their 80s or 90s, it's still there, but it's not a huge problem. Other people, it just quickly degenerates, right?
That is correct. You couldn't have said it any more eloquently, because when you see one person with Parkinson's, you've only seen one person with Parkinson's. That everyone manifests so differently. Even last week, I had someone who was about 92 years of age and has had Parkinson's for 15 years and barely had any progression of symptoms of tremor, and still very active, actually still golfs, and always ask me how I can give medicines to get the score down in golf, but it's very, very minimally progressive, so everyone's so different.
Yeah, and that's got to be a challenge for you and other physicians in this field, because it's not just one medication or cure. That's true of many, many different diseases, but some of them are, kind of follow the same similar pattern. But with this, you really got to look at the individual very, very carefully, see where they're at and what needs or maybe doesn't need to be done.
Correct. I mean, that's challenging, and it's also quite fruitful as a physician, because you get to know the patient, you get to understand the family, the dynamics. The key aspect, again, is developing that close relationship with the individual, is understanding their course and what's affecting them. You can really get to nitty gritty and then help them in this disease.
And this is where the Hoag Center comes in, and the program that you folks have is how you work with each patient, and you have a whole team that's there to kind of work together and figure out what may be best, because sometimes it's the medication, it could be the medication with exercise and diet. They're all different specialists and centers that kind of work together on this, right?
Yeah, I mean, one of the best things for me is when I left the university, I came down from UCLA, and it was a win situation for me as a professional, because from an executive standpoint at Hoag, they really care about the individual programs and their patients. They set up a wonderful physical therapy department. In fact, it's grown to 2 locations that are physical therapy trained in Parkinson's, and then we have speech therapists that are trained in Parkinson's and movement disorders, and then there's occupational therapists that are just wonderful, that go beyond just medications and help with activities of daily living and help with penmanship and buttoning and sewing and different aspects that what patients have actually been missing that medicines may not reach. And then at the same time, we have a wonderful surgeon who can help. We have a GI proceduralist that helps with the new pump. I mean, and then my colleagues are just wonderful. Just even if they're not the movement disorder specialists, the neurologists, really, we know how to collaborate, and it's been a wonderful institute.
Yeah, well, that's good to hear, and it's nice that there are progressions with this. In other words, within the treatments, like the pump and things like that. And really, as you mentioned, is about people living with it and managing it, the best that everyone can. And I think the key is diagnosing it early, like with so many other diseases, and figure out, yes, this is what you have, and now we can go forward.
Yeah, the disease state, catching early will always allow us to modify the course of the disease to a certain degree, and also early awareness, education, and getting on the right path. I mean, again, physical therapy and exercise is so key, and we can help secure balance so we can prevent falls, you know, help manage even mood and the emotions that come with the disease, and then again, the connections that we have within the community with the psychiatrist, the psychologist, the marriage family therapist. I mean, it's so key to get early on this.
Right. Great to have you back.
Appreciate it.
I hope to see you again soon.
Most definitely.
Doctor,
Thanks for
thank you very much. And if you want to find out more about this, you can go to hoag.org/neurosciences, and the number is on the screen, 764-6066. We'll be right back.